Welcome back, and in case you're just joining us, the CEO of the National Primary Healthcare Development Agency, Dr. Mohammed, is our guest on Question Time. Going through the full report of the World Health Organization, it still calls for a bit of more work because they are saying until 2017, that's when Nigeria could get the free polio status. So what does this mean for Nigeria?
Of course, we are 1 year without a case of polio virus in Nigeria. 1 year without a child being paralyzed in Nigeria. What that means is that Nigeria has interrupted the transmission of polio virus. What that also means is that Nigeria will be removed as a polio endemic country. But between interruption and eradication, a lot of things need to happen, because there is a difference between interruption and removing Nigeria as a polio endemic country, and then Nigeria being delisted as issued certificates of eradication. So there's a difference between interruption and eradication. Now, in between, there are a lot of things that need to be done for us to attain that status of being a country that is polio-free, which means a country that has eradicated polio, which will translate to issuing us with a certificate of eradication. Lots of things will happen. First, we need to continue to carry out intensive surveillance so that if there is any case anywhere, our surveillance system should be able to pick it. And with the status of our surveillance system now, which is about 85% sensitive, we are comfortable that we'll pick any case anywhere it is in Nigeria. Secondly, we also have to continue to carry out our campaigns, the polio campaigns that are normally done based on the epidemiology. This will continue to do, and will continue to improve the quality of those campaigns. So parents should not be surprised to see us in their houses coming to immunize children. We need to sustain the gains up till 2017. Thirdly, we also have to continue with routine immunization in such a way that in our health facilities, in our fixed posts, it's not only during campaign, but children should be immunized. So those three things will continue. And we have also gone beyond that to also activate environmental surveillance, so that if there are viruses within the refuse and then in the environment, we'll pick them. And then we'll also respond to that as if a child has been paralyzed.
What's the fate of Nigeria should a case resurface, just like we had Ebola resurging in some West African countries? So what's the fate? Will this affect our chance of getting the full certification come 2017?
If there's any reinfection, if a case surfaces, we have to, it will affect Nigerians' chances of getting a certificate by 2017. And that is why we'll continue with those things that have brought us from 122 cases in 2012 to 0 as of now. So that 0 status of polio in Nigeria has to be sustained. And we are committed to making that happen. You recall that a few days ago when Mr. President immunized his granddaughter, he gave us marching order as an agency that no child in Nigeria should be paralyzed again by polio virus. No reinfection should take place in Nigeria, and is committed to having a polio-free Nigeria by 2017. That means a country that has eradicated polio virus. We are committed to that. The Ministry of Health is committed to that. The Permanent Secretary Ministry of Health has also reaffirmed that the ministry will continue to provide leadership in terms of ensuring that we sustain the 0 polio case in Nigeria.
Some experts are saying that this anti-polio campaign can't be sustained. Do you think it can really and honestly be sustained?
It can be sustained. I want to tell you with every sense of confidence that we can sustain it. If you look at where we are and where we are now, so much progress. In 2012, Nigeria was the epicenter of the global polio challenge. Nigeria reported more cases than any other country. In fact, Nigeria was the country that was given the least chance of the possibility of interrupting. Afghanistan and Pakistan were being tipped as the two countries that would have interrupted before Nigeria. But by the time we brought in a lot of innovation, a lot of program modification, and then with the hard work, commitment, and support, and ownership, and government funding, we were able to turn the tide. And today, Nigeria has the best polio program among all the endemic countries. And those other endemic countries have been even asked to come and study what we did. I'm sure in the course of our discussion, you will want to know what are those innovations that we brought into the program. But I want to tell you that we are very confident as a sector, as a program, and as a people, that yes, we are going to sustain that gain. And by 2017, we'll give to Mr. President the certificates for eradication.
So what's the availability of polio vaccines to the common Nigerian?
We have two levels of availability through the campaigns, which is the polio campaigns that we carry, which is house to house, that we conduct at intervals. And we also have availability through routine immunization, which is facility-based. So in both campaign, during campaign, and then through the facility-based platform, the vaccines are available. So I want to assure Nigerians that the vaccines are available. So all you need to do is to walk into a health center and you get immunized, and also to avail your child during campaign, house-to-house campaign. These vaccines are available everywhere. The last time Nigeria reported any stockout of vaccine is in 2011.
You can join in this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, what are the innovations introduced by the Nigerian government in preventing a resurgence of polio in Nigeria? Find out when we come back.